If you're one of the many Americans suffering from back pain, you may be wondering, does acupuncture work for back pain? In 2019, opioids were involved in an estimated 69,029 deaths related to overdose, according to the CDC. Because of this, Medicare approved acupuncture as a treatment for back pain in January 2020. And according to a study published by the Annals of Internal Medicine, back pain is responsible for more Americans seeking supplementary healing practices than any other condition. So you may be wondering, could acupuncture be the solution to my back pain? The short answer is yes. And in this video, we're going to share some of the research on acupuncture for back pain, along with some of the other things you should know about utilizing this ancient health modality to treat back pain. First, let's look at the research. The U.S. National Library of Medicine states that research suggests acupuncture can help manage certain pain conditions. And the American Pain Society states that acupuncture is one of the most common non-pharmaceutical pain-relieving treatments. Some studies have shown that acupuncture increases adenosine concentrations, which inhibit pain receptors on nerves that transmit pain. This temporarily reduces the sensation of pain by blocking the transmission of pain to the brain. Acute versus chronic pain. As you probably already know, there are two main classifications of pain, acute and chronic. Depending on what type you experience, acupuncture works differently for each. A meta-analysis published in the Journal of Pain in 2019, reviewing 39 studies and 20,827 patients, confirmed that acupuncture has a clinically relevant effect on chronic pain. Two other findings that are of interest from this article are that the effects of acupuncture persist over at least 12 months. That's great news, as it means that the positive benefits of acupuncture for chronic back pain are not just experienced after the treatment. Additionally, the researchers stated that specific effects of needling at correct acupuncture point locations are important contributors to acupuncture treatment benefit. This means that the skill and understanding of your acupuncturist in needling the correct points is actually a very important factor in how effective your acupuncture treatment is. However, it is also important to note that not all back pain is the same, and you should consult with a healthcare professional to determine if the type of back pain that you are experiencing is responsive to acupuncture treatment. For acute pain relief, acupuncture has been shown to be more effective than medication, and this is certainly encouraging to anyone who's concerned about medications like opiates. So what about low back pain? Is acupuncture effective? Many studies have shown that acupuncture is effective for chronic low back pain and pain relief. And further meta-analysis, like this one, have looked at 33 studies to determine that acupuncture is effective for chronic low back pain. One of the most frequent questions we get is, how many sessions of acupuncture will I need? The number of sessions you'll need will depend on the type of back pain that you're experiencing, whether it's chronic or acute, and will depend on the recommendations of your acupuncturist. Most trials and studies had participants receiving acupuncture anywhere from once a week up to 6 times per week. You may wish to start more aggressively with a higher frequency of treatments at the beginning and taper off to weekly acupuncture treatments. Also keep in mind that some studies have shown the effects of various therapies are only temporary and may require some amount of continued activity in order to remain pain-free. Cost is always a consideration when people are considering any kind of complementary or alternative treatment. The average cost of acupuncture will vary depending on your area and the individual practitioner. For example, an acupuncturist trained at the Shaolin Temple in China who works out of Phoenix, Arizona, charges $150 per session. Based on the average cost of acupuncture, you may pay anywhere from $300 a month upwards to $600 a month for highly skilled practitioners. If you get acupuncture 2 to 3 times per week, the cost will go up significantly, especially if your practitioner is highly skilled. You may consider community acupuncture if the cost of these treatments seems prohibitive. Community acupuncture sessions may cost anywhere from $15 to $20, but you'll want to check in your area. This will allow you to receive acupuncture maybe 3 times a week for a mere $60 a week or $240 monthly. The other thing people often want to know is if Medicare will cover acupuncture. In this case, the answer is yes. The Centers for Medicare and Medicaid Services made a decision to cover acupuncture for Medicare patients with chronic low back pain in January of 2020. Some people are concerned about how long it will take for acupuncture to work, and we want you to understand that the results of acupuncture can be very subjective. Everyone experiences them differently. Few people experience immediate relief after just one treatment. In addition, acupuncture is not a cure-all, and like any therapy, there's no guarantee of success. Lastly, as with any kind of complementary or alternative medicine, people always want to know if there's side effects. The side effects of acupuncture may include pain or bleeding during needle insertion. Headaches, body aches, nausea, and fainting may also occur during or after treatment, but are often only mild and transient. More serious side effects are rare, but they can occur, such as hepatitis C infection. There are many complementary and alternative therapies that may help with back pain beyond just acupuncture, and those include biofeedback, chiropractic, guided imagery and visualization, or also sometimes called hypnotherapy, massage therapy, meditation, rolfing, or yoga. If you'd like to learn more about any of these types of therapies, visit mayallbewell.com. You may also find practitioners in your area that will help you with your back pain or any other conditions which you may be suffering from. The name May All Be Well is a blessing, and it's something we're putting into the world to help people who are suffering from conditions that can be helped and sometimes healed through the use of complementary and alternative medicine. If you found this information to be helpful, please like and share it with others who may also be suffering. In this way, you may spread the blessing, May All Be Well, to others. And be sure to subscribe to our channel and hit the notification bell so you can see our newest videos on alternative therapies and self-care techniques for greater health and well-being. Until next time, may all be well.